Firstly, what is constipation? It's the passing of small, hard stools less frequently than is usual for you. Everyone is different. They should pass comfortably, no straining, no pain or bleeding, no stomach pain, ache, bloating, feeling like you're carrying a week's worth of food around in your bowels, which is actually possible, not nice. The main causes are not enough fibre or fluid, too much sitting, inactivity, and some medications. It can be stress, anxiety, depression, although sometimes stress and anxiety can have the opposite effect. Pregnancy and some medical conditions such as IBS and diabetes, and neurological conditions such as Parkinson. For mild constipation, before resorting to laxatives, we would recommend the following: increasing fibre in your diet, increasing fluids, increasing physical activity, and also, if you can use a footstool when you go to the toilet, this will help stools pass more easily. Let's just go back a little bit and talk about what your poo should look like. There's something called the Bristol stool chart, which you can have a look at online. I couldn't find an uncopyrighted picture and didn't want to pay for a picture of poo, so I've created my own with a few bits missed out. What you're aiming for there is number 3, a perfect sausage. Number 2 is not too far off. It's quite easy to pass. It's well formed, has cracks on the surface. There's probably enough fibre in the diet, but not enough fluids, I reckon. Have a look at those pictures there. Do you recognise yours? Let's now move on to treatments. If none of the advice that I've recommended so far works, come and see a pharmacist or GP. We'll be happy to help and advise treatments tailored to you. Here are a rundown of different treatments and how they work. Bulk forming laxatives. These are great for small, hard stools if you're struggling to increase fibre in your diet. Increasing fibre and fluids should always be first line, as mentioned, before resorting to laxatives. These are recommended for patients with colostomy, ileostomy, hemorrhoids and anal fissures, which are tears in the lining of the large intestine near the anus. Ouch. When using these treatments, keep fluid intake high to prevent obstruction. They're not to be used if you're taking constipating medication such as codeine. And time to take effect is usually about 2 to 3 days, not quick. Some examples are on the screen there. Ispergula Husky is probably the most common, or fibre gel. Methyl cellulose, haven't sold that in years. If you're struggling for ideas in how to increase your fibre in your diet, try for breakfast a bowl of bran flakes with some raisins and shredded coconut. It's so nice. Osmotic laxatives increase water in the large bowel by drawing fluid from the body or by retaining the fluid they were administered with. So you can see it's important to keep fluid intake high whilst taking these. I'll talk through a few of these examples in turn. Sorry, but it's a lot of information, but remember, knowledge is power. So the first example is lactulose. This is a semi-synthetic disaccharide or sugar, which is very sweet tasting, but it's not absorbed from the bowel. It can take up to about 48 hours to take effect, so must be taken regularly if needed. A question I often get asked is, can it affect my blood sugar if I am diabetic? Which is fair enough, it is very sweet. I will answer that for you now. The general consensus is no, it does not. A study actually looked at the effect on blood glucose in the World Journal of Diabetics in 2015, and it demonstrated that 20 to 30 grams of lactulose did not affect blood glucose levels in non-insulin dependent diabetics or type 2. It can affect levels if you take very high doses for a long time. For example, if you have hepatic encephalopathy. Sorry, I just cannot speak today. Hepatic encephalopathy. Moving on then, macrogols next, such as Laxido, Movicol. These sequester fluid in the bowel. Onset of action is 24 to 48 hours. They can be used for disimpaction of fecal masses or for general constipation as well. Next, we have the fecal softeners, such as arachis oil or glycerol suppositories. These are also a weak stimulant or a mild irritant. They lubricate and soften impacted feces and promote a bowel movement. Glycerol suppositories are fast, often working within about 20 minutes, but they only stimulate the anal area and remove what's already waiting to be passed. Next, the stimulants, probably the most popular over the counter. These increase intestinal motility, so can cause bad cramping, avoid if there's any chance of obstruction, If you have severe stomach pain with your constipation, avoid these like the plague. Use an osmotic instead. Too much of these can cause diarrhea and hypokalemia, which is a decrease in potassium levels, which is not good. It can cause weakness, cramping, fatigue, and heart arrhythmias. And conversely, more constipation, which we don't want. They are generally quicker to act, sometimes in about 6 to 12 hours. So I've popped some examples on the screen there with how long they take to work. There's also the suppository versions of them as well. So that's most of them covered then. I hope you found this useful. There's a lot of information here, but I believe it's best to be fully informed of your options. And I know I do talk too much, I'm sorry. Sorry, before I go, I just want to raise the concern about laxatives and abuse. There is an issue of abusing laxatives, either becoming dependent on them rather than tackling the root cause, or people taking them in the belief it will help them lose weight. This is not true and just causes quite serious health risks such as electrolyte imbalances, depression, heart problems, and an increased risk of colon cancer. Please get advice from your GP if you have become reliant on laxatives. Thank you, everyone.